Well, good afternoon. I know I've got the daunting task of being between you and lunch at the moment, so I'll do my best to keep your interest. My name is Michael Piscos. I work for a company called GN Hearing, and we're essentially a company that really works with hearing, audio. We have some sister companies as well, but one of the primary things we focus on are hearing instruments, hearing aids. And you know, we've talked a lot about today, and this is great. I've never actually been to one of these summits before, and it's great to be part of an audience who's really forward-thinking in terms of how they want to integrate their patients into the process. But we're kind of talking about it from up here, but in reality, a lot of this stuff is real. It's applicable even to our own lives. So I often like to start by asking a couple questions, and just do a show of hands. How many of you know someone who wears a hearing aid? Quite a few of you, okay. How many of you know someone who probably should wear a hearing aid that doesn't? Okay, fair enough. So there's a huge percentage of people out there that are not benefiting from this technology for a variety of reasons. And we're going to talk a little bit about that, but we're really going to try and talk about where the future, or I should say really even the present of hearing technology is and where we hope it will go moving forward. So let me just give you a little bit of background as to what the hearing loss population around the world is. So you can see it affects more than 500 million people worldwide. This is a huge, huge population that we're talking about. 360 million, about 5% of that global population, has it to a disabling point of view where they would actually maybe seek some professional help. Again, very, very large number. And one of the things we often forget about when it comes to hearing loss are secondary problems. The primary problem of having hearing loss is obviously you cannot hear, thus most people think, well, it's a communication. And that would be a primary problem. But not being able to communicate can lead to a lot of other secondary characteristics, such as not being able to communicate might make going to the cafe or going out to dinner with your family more frustrating. After a while, you choose not to join them anymore, so you become a bit more isolated in that sense. It's a use it or lose it. Sometimes you'll know people who've had hearing loss for a very long period of time. It starts to affect their language to some degree. People can become depressed if it's affecting them at their workplace. It could affect income and things like that. That could obviously lead to other issues in life. So there's a lot of secondary and tertiary issues that come along with hearing loss. I'm going to take this quote a little out of context, but as you can see, some years ago, the quote of "there's no reason why any individual would have a computer in his home." And as some of us are checking our phones right now, obviously that did not hold true. And as I said, I am taking a little bit of out of context, but I can tell you the presentation that I have up here is approximately 40 megabytes, which is probably larger than most of the hard drives back in those days, considerably. And most of us probably have phones that are 16 or 32, 64, 128 gigs, which was really almost unfathomable to a consumer point of view back in these days. So we're going to break hearing loss into kind of three groups moving forward. We're going to have the technology, which we're going to talk about a little bit, the demographics, and also how do we distribute this out to the public. I'm going to show you some numbers that have really kind of indicate that we haven't done a very good job as an industry penetrating our market, thus not giving the product to the people who really need it. And I'll show you a couple of reasons why that might be. But we're going to start off talking about technology and a little bit more of a current piece of literature from Kevin Kelly. He talks about the 12 technological forces that are going to kind of shape us moving forward. And I'm going to focus on three of them today. Becoming, cognifying, and flowing. And we're going to start with becoming. And becoming is really just synonymous with the word evolving. And as you can see, the caterpillar turns into the butterfly. And that's just talking about how technology can morph itself into something from its original state. We've all probably still have a relative who might have a flip phone. And that's fine. They will probably tell you that they use it when they need it. And that flip phone will never be more than what it is. That's it. When they purchased it, that's it. There's never a software update to it. What they purchased is what they have until the end of its life, which most likely means until the battery runs out or something along those lines. But most of us now have smartphones, which the original hardware you purchase has now been updated many, many times through the software, and thus your phone kind of morphs and evolves over time as to what it can do. And that's really what we're talking about here. And anyone who has an Apple-based product or knows that when iOS comes out, we all get the notification, and there's only a point in time where we're going to have to update that software. Otherwise, our phones just won't work the way that they need to anymore. The second one is flowing. And the flowing has to do with sort of the seamless transition of how do we put these things together. And to give you a little look into our portfolio, and this is what I think is very, very interesting to people, is the top portion of the hearing instrument. That's the product line that we have. The black ones are what we call behind the ear hearing instruments. Those are the ones that go over the ear, connect to a tube, that go with a custom-made ear mold or a tulip or a dome of some sort. As you move over to the more beige-looking ones, you're looking at custom-made products. These are made by taking a mold. There's an investment created, usually using some sort of 3D printing. We now can create these and then put the circuitry inside those custom devices. And there are benefits and disadvantages to each one of those, and a lot of it's dependent on the needs of the patient. But as you come down, you can see we've got a number of other categories there. We've got apps. You can actually control the functions of your hearing instruments or directly stream audio from your smart devices directly to your hearing aids. You can do that with today's technology. And you've got a number of other accessories there that allow people to connect to their TVs, that allow people to connect to their phones, and using some 2.4 gigahertz technology, we can stream all that audio directly to the instruments so that people don't have to fight over how loud the volume control is on the remote control anymore when they're trying to watch their show at night. And this is really something that exists today and will continue in the future, where we walk into a particular location and we connect to multiple things. And you can imagine how someone with hearing loss, typically right now when you go into maybe like a movie theater, there are loop systems that people can connect to and thus get a direct audio stream. But moving forward, we have much better technology than loop systems, and hopefully we can integrate these technologies into a variety of different environments that are out there. And the last one is cognifying. And cognifying in simplistic terms is essentially taking something that's not very smart and making it smart. It's giving it some learning capabilities. And one of the ways to do this is to use biomimicry. Nature does it best, so why not just try and mimic nature? And that's what we really try to do now with the hearing instrument technology that's out there. Our newest product that we've just recently launched is our Resound Linx 3D product, okay? And this does a number of different things. Besides the unmatched sound quality, which we've been known for in our industry for a number of years, you're going to have more efficient fittings. We can actually fit these devices via wireless connections so that someone could be in their clinic. The clinician can connect them to the software and make the adjustments that they need to completely wirelessly so that people aren't having wires around their necks. And anyone who's ever been fit with a hearing aid with these wires knows that, one, you're limited. You have to be fairly close to the instrument. And it's just not a comfortable experience as well. And then the remote fine-tuning, which is something I'm going to highlight in a little bit here, because this really allows the patient to be engaged and interactive in their needs, even from environment to environment as well. A couple of testimonials. The one on the right here, Molly, I've actually had a chance to work with her. She's over in the UK. She's a very, very amazing girl who has Usher's syndrome, and she's had a severe to profound hearing loss most of her life, and her vision has been deteriorating over time as well. And she's been using our products for quite some time, and the remote technology for someone like her has been incredible. Because obviously starting to lose her vision, she relies on her hearing so much, and one of the main problems people have with conventional hearing technology are signal-to-noise ratios, is not being able to hear what they want to hear amongst a lot of other sounds. And through this wireless technology, we can transmit the direct sound while reducing that background noise, thus increasing signal-to-noise ratio, which is incredibly beneficial for people like Molly as well. But the other thing is, it's not that easy for her to get to a clinic. She's got to, logistically, she's got to put some transportation together. She has a guide dog that has to be considered. It's not as easy as some of us just incorporating it into our schedule. There's a lot of logistics that have to go into place. So something like the remote fine-tuning, which we're going to talk about here in a minute, where she could actually contact her clinician through our app wirelessly and request a change to the way the settings are set on the hearing instrument, and thus the clinician can then identify that request, make the change, and within a matter of just a few short minutes can have an adjustment in her hearing aids that she then downloads from the request, that, or I should say that the message that is sent from the dispenser. So being able to do something like that, imagine Molly moved to a new location, she's going to a different cafe to do her work during the day, and the environment, the sound environment of that location could be different. This could save her a trip from going back to the clinic, and it's not meant to say it's going to do that every single time, but you can see how this could fit into a larger paradigm to provide some convenience for people as well. We've been able to provide personalization within apps for quite some time now. People can do beam forming. They can narrow or widen the beam of the directionality in a particular environment. Noise reduction features, wind noise reduction features. These are all things that people have and have had for the last couple of years in the hearing instrument technology world. The second one I want to talk about is demographics. In the USA alone, approximately 10,000 people turn 70 every day. So if you think about that number expanded over the entire globe, that's a large, large number. My parents, my dad's 72. This is a person I never thought would get up to speed on smart technology, but you know, he does what he can do. He checks his stocks, he reads his news articles, and he's pretty happy, but he does incorporate this into his life. My mom, who's 68, she's got her blog, she's a writer, she's got her website, she's connected to all these things. And unfortunately in our industry, there's this myth that people above the age of about 60 or so don't really use this technology, and that really is just a myth. We know a lot of people use this technology, and we want to really get this into more people's hands. And obviously, the younger generations are expecting this technology. I'm fortunate that I get to talk at a lot of universities, and when I show apps to the students, they're not wowed. It's expected from them, because they've grown up in a world where they don't know any differently. So here comes the boomers. This was some information that was collected from the Ipsos market research development team. And they did it over September, October in 2016. And the interesting numbers here, 25% of the respondents indicated they currently wear a hearing aid or other device to assist their hearing. About the same number responded or visited a hearing healthcare professional regarding their hearing loss in the past year. But what they were asking was, they asked about 1,000 people who perceived they have a hearing loss. And some of you may be looking at that number and say, well, that's not a very high number. And I would completely agree with you. And it kind of reiterates what I was saying, is we haven't done a great job in our industry really promoting this technology and being able to get it into the people's hands. And we're hoping through some of these new wireless technologies and remote services, we'll not only be able to create more efficiency in the fittings and more personalization, but educate and make people more knowledgeable about hearing loss so the people who need these products can be using them. Looking a little bit more at sort of the telehealth audiology aspects of things, you can see over a third of the people over the age of 55 were very interested or somewhat interested in incorporating telemedicine into their healthcare plan. And of those using a wearable device, about 30% wear an activity bracelet and 30% use a smartphone. So the point is, these people are incorporating other types of technologies in. This could be another type of technology that they can incorporate into their lifestyles. Main problem is they're not aware that this stuff is out there. So some key survey findings: users see benefits of telehealth. Is 1 out of 4 of the total respondents answered that the telepresence will allow their doctor to customize their treatment regime. So they understand that there's some personalization aspect to this, and that's the important thing, because everybody's needs are different. And people's needs can be different from environment to environment as well. About 73% of the respondents have a desktop computer, 68% have a laptop computer. Again, it's to show that they are integrating this technology into their habits as well. 65% of all respondents have a smartphone. So about 2/3 of the people responding have the devices that allow them to use these technologies already. We just have to do a better job of educating people in our industry that these features are available. I'm going to take a moment here talking about something called screening. And screening is really just taking any article of information and putting it on a screen. And we've all become victims to this. Everyone now has a smart device where we look at the screens. We watch TV. So why not get onto that screen and be able to provide assistance to people as well? And you can see, I don't have to tell you these numbers, we all know this, that the penetration of mobile devices has increased just incredibly rapidly, more than almost anything I've seen in recent history. So the future hearing aid wearer can be expected to choose brands that offer these benefits. As I said earlier, the younger cohorts, they're expecting this technology. And we're identifying hearing loss much younger as well. It's not just an old person's problem anymore. We're identifying a lot more people in their 30s and their 40s with hearing loss, mainly because I think part of it is educating people. I do think part of it's the cosmetics of the devices have gotten better. I also do think some of the yoga cohorts look for this type of technology. So when they find it, they're very, very pleased. So I do think we're able to extend our products into the younger age ranges. But you can see that people are very likely to incorporate this, and they're open to it. But the numbers are low because I think part of it is people don't really understand it yet. They don't understand how it's going to benefit them. They don't understand how it's going to be incorporated. Just because somebody can do something doesn't mean it always necessarily perceptually benefits them as well. So one of the things we also looked at is we wanted to see, do people even know how to install these applications? Because if they can't install the applications, then obviously they can't get the benefit of using them. And what these graphs are showing you is the one on the left where it says 82%, 0 meaning you weren't able to install, 1 meaning you were successfully installed. You can see that 82% of the people were able to install it, okay? The one on the right, it's looking at the time it took to actually install, and you can see that the large majority of people were able to do it in under 10 minutes. Now, 10 minutes is probably still too long, but that goes to the education. We would have to do a better job of educating the clinicians as well, and anybody who's exchanged in this entire process. Many people are using this technology. You guys are at a summit hearing about a variety of technologies that incorporate this wireless and remote assistance type of technology out there as well. So it's not something new, it's something new to our industry. And then lastly, how do we get this out to people? I've kind of reiterated the point a few times that there's a lack of education. But there's a research article that came out a couple of years ago, and it really just kind of reinforces what I've said, that people are open to the idea. They want to understand how it could work, and then there's the necessary education that takes place, and then obviously to show them that there's some convenience to it as well. The whole thing is about being able to personalize on your time. So this, for example, is a comfort in noise, a noise reduction feature that we offer. And all somebody would have to do is open up the app. If they're in an environment where that happens to be a little bit noisier, so a really good example of this is once somebody leaves this room and goes out into the hallway, the background noise is going to pick up for a variety of reasons. There's more people there, the hallways are larger, so the sound's going to bounce around more, there's reverberations and reflections. You know, you're a little out closer towards the street, you might get some traffic noise. Even at lunch, the room noise will get louder. Somebody needs the ability to be able to make that adjustment right then and there, because lunch is a transient thing. It's going to happen, and then it's going to stop, and the acoustic environment's probably going to go back to something similar it was before, and then after lunch they'd be able to slide that back down and not have as much noise reduction, because one of the things you also have to remember is hearing instruments are still computers. They can't predict human intent. They don't know what the person wants to listen to, so we're making best guesses based on algorithms and computing different incoming signals to make a decision as to what the most important signal to that person is. But like anything else, we're not going to get it right 100% of the time. Giving people the ability to personalize lets us compensate for that to a little bit, to some degree. So ultimately, what is Resound Assist? Well, we're connected to our GN Cloud. It's our online services. The user has their mobile device. They could also use a tablet as well. They would download our smart app. And now in the latest version, with our Resound Linx 3D, they can make a request directly from the app that gets sent to the cloud. That then gets to the hearing care professional, where they get a little system tray icon that gives them a notification that there is a remote request from them. They can open it up at their leisure, and then they can work with the client at that point. There's the ability to text message. Obviously, they can also call on the phone if that's something they want to do. But they could also text message what they'd like to have changed. Then the clinician could go into the software, make those changes, and then send it back to the cloud. The patient would then get a notification on their mobile device. They can then download that from the app, and it would make the changes right there live on the spot. In the past, they would obviously have to go back into the clinic, and they would have to make an appointment and have to maybe even wait days, if not a week or so, more than that. So how does it work? It works for a variety of different reasons. This is kind of how I said, the patient needs help, server gets sent to the cloud, clinician finds out that it's there, makes the changes, sends it back to the cloud, and back to the patient it goes. It could benefit a variety of people, not just people like Molly that I talked about, who might have some syndromes or other issues and challenges going on in life that logistically can create some problems, But even for everyday people, think about people who are, I'm someone who travels a lot myself, representing the company. I don't have time. Sometimes I know my mom would wish I would make more dentist appointments than I do. Sometimes I just don't have the time. I'm not sure how I'm going to do a remote fine-tuning dentist appointment just yet, but who knows? Maybe 10 years from now in a summit like this, we'll find that out. But we can do it with hearing loss, and we can do it with hearing aids, which benefits a lot of people. Convenience, real-time feedback, and people can make adjustments that are personal to them that really allows them to customize the solution. It allows the clinician to engage with the patient, enhance their level of care, and reduce their number of follow-up visits, which allows them to open up time to see new patients who hopefully will need some hearing instrument technology to benefit their lives as well. So again, I come from GN Hearing. Resound Linx 3D is the newest product that we've launched, and that comes with that new feature that I've talked about, which is our Resound Remote Assist. Thank you guys very much.